program now. We are going to welcome our featured speaker, Dr. David Kingsley, retired from KU Medical Center. He has worked for over 50 years in the healthcare field and currently is doing some advocacy work in Washington. I will not belabor all his lengthy bio, but let him tell you a bit about himself. If you would please give a warm Oasis welcome to Dr. David Kingsley.
Well, it's a pleasure to be here today. Thank you for inviting me. I get the feeling this is a group I can relate to really well. I must say also I really enjoyed the music, really good. My kind of music. The title of my talk is Bioethics, Biohumanism, and the Medical-Industrial Complex. I will allude to all of these things, but the real issue is U.S. healthcare system, such as it is. The healthcare system is not just the medical delivery system, by the way. Nevertheless, medical care makes up the lion's share of healthcare. It's the dog that wags the tail, and that has a lot to do with this talk. You know, when I think of the U.S. healthcare system, I'm reminded of what Gandhi said when he was asked what he thought of Western civilization. He said it would be a nice idea. I can say the same thing about the U.S. healthcare system. It would be a nice idea. The truth of the matter is our healthcare system, or what passes for a healthcare system, is a mess and a disgrace. Consider this. We spend at least twice as much per capita and as a percentage of our GDP than our advanced industrialized peer countries. All of them. Sometimes we spend 3 times as much. Much of this money is spent on advanced technology that we could only dream of a couple of decades ago. However, a large share of it is spent on excessive charges for pharmaceuticals, hospitalization, medical imaging, implants, and other medical goods and services. Much of this for illnesses that could be prevented. Furthermore, we have 30 million U.S. residents that are uninsured and have little to no access to medical care. Untold millions more are underinsured and overcharged for premiums, copays, and deductibles. The U.S. infant mortality rate is 6 per 1,000 births. That's double the rate in most of our peer countries. Probably the next largest infant mortality rate is 3 per 1,000, but some are down to 1 per 1,000. We have 6 per 1,000. And that seems to be staying there pretty over the last decade or so. Tens of millions of our children are exposed to toxic water and other substances and environmental conditions that damage their mental and physical development. Poor children are often stuck in Medicaid, in many states an inferior third-rate medical care system with reimbursement rates so low that physicians and dentists won't treat patients eligible for the program. And I can't blame the dentists because they can't work for nothing, nor the doctors. We just recently had reported a case in Florida. Hundreds of thousands of children were not receiving dental care under Medicaid, and the reimbursement rates were so low that parents would have to drive hours to a doctor for an ear infection or something of that nature. The Academy of Pediatrics, American Academy of Pediatrics, sued the state of Missouri in 2000, or Florida, they could sue Missouri too, in 2005, and now it is 2016, and they just got a judgment that the state of Florida has to shape up by 2022. We have incurable rates of heart disease, cancer, and diabetes. By the way, African American men have double the rate of cancer than any other group when it comes to prostate, lung, and colorectal cancer, but we don't hear about that. We have a deterioration in the health and consequently the life expectancy of large segments of the U.S. population. This is a phenomenon that we've never witnessed in the United States and rarely in the Western world. We saw it in Russia after the fall of the Soviet Union. We saw life expectancy decrease, but now we've seen For instance, we knew years ago that females with less than a high school education had lost 5 years of life expectancy, which is a sign of deterioration of our health. Well, I could go on with innumerable examples of our failed healthcare system, but I believe you get my point. So my question is, how did we get here? How did we come to have such a shameful healthcare system in the year 2016? And that's what I want to talk about. So let me proceed to make my other points. In this regard, I want to tell you a story. As a faculty member of the Department of Health Policy and Management at KU Med, I designed and taught Ph.D. level statistical courses. One of those courses was entitled Statistics in Large Databases. I taught with a massive hospital data set which I purchased from the federal government. This database was made available annually and included 8 million hospital cases, about 20% of a random sample of all hospital discharges every year. Given the conventional wisdom that the elderly are the most expensive hospital cases, I took a look at the hospital charges by 5-year age categories. And here's what I discovered. Average hospital charges increase for each 5-year age category up to the age of 70, and then they begin to drop. Actually, the peak average age is 67. After age 70, average hospital charges by age category drop steadily and drop precipitously after age 80. That's the old as we say. I also noted that the largest and most frequent charges in that 65 to 70 age category were for procedures pertaining to heart disease. This pattern persists from year to year. I've been looking at this since 2003. I still look at it. I still buy the data set. Although this phenomenon has been clearly established and reported in the medical literature, very few people know about it, and most people, including physicians, are shocked to hear it. I decided to discuss this issue with Dr. Caldwell Esselstyn, one of the most renowned cardiologists in the United States who practices at the Cleveland Clinic. He was very familiar with the phenomenon that I had brought to his attention. Here's what he said. What you are seeing is a natural history of a disease. Atherosclerosis starts at an early age, but does not typically become clinically significant until middle age. We discovered atherosclerosis during autopsies on young soldiers during the Korean War. This was a revelation for the U.S. medical profession. The Germans had discovered this around 1900. But autopsies on infants, as part of what is called the Bogalusa study, revealed atherosclerosis even in infants. Here is an important point about Dr. Esselstyn. He became disenchanted with invasive heart procedures and changed the treatment through a diet that is so strict that a lot of people just cannot abide it. He's a pretty good colleague of Dean Ornish. Most of you have heard of Dr. Ornish. He has reported very good results and has written a book about it. I asked him why treatment like he was doing was not more prevalent, and here's what he told me. You don't get reimbursed for counseling patients on diet. Please keep this story in mind as I return to the question, how did our healthcare system come to be what it is? We decided in the 1980s that the market would solve all of our healthcare problems. That private enterprise would be much better than government in the delivery of healthcare. Medical care is big business, and make no mistake about it, it is a business. Like water flows downhill, capital flows towards return on investment, or what we call ROI. Recognizing that diseases like atherosclerosis begin early in life and preventing them will not appeal to Wall Street and the hedge fund spawned in the past few decades to channel capital into the most lucrative enterprises. Let me allude quickly to Eisenhower's speech regarding the military-industrial complex. What he said was this: we have something completely new, a permanent military establishment driven by an industrial, government, scientific, academic nexus, a network, if you will. The danger, Eisenhower believed, was this: we would get far more military than we would need. It would be a natural tendency for those benefiting from this enterprise to co-opt other institutions in society and capture government to further their interests. He foresaw how this would be a threat to our democracy and consequently to our well-being. Let me fast forward 20 years to a speech by Dr. Arnold Relman, editor of the New England Journal of Medicine. Dr. Relman paid homage to President Eisenhower by coining the phrase medical-industrial complex. We were, in the 1980s, beginning to see the growth of a new type of medical delivery system. Massive corporations in the nursing home, hospital, business, and medical device manufacturing and pharmaceuticals. This was something new in America. Most of our history, healthcare was delivered by charitable institutions. It was delivered by professionals and a professional system. This, he pointed out, would require massive amounts of capital and would therefore be of great interest to Wall Street. That our medical mission would be misdirected from the most efficient and best for our well-being to one that unduly benefits investors. Indeed, here's what has happened. The universal healthcare system that was so badly overdue came to us recently in the form of the Affordable Care Act. If there was ever an example of private industry dictating healthcare policy, it is the so-called Obamacare plan foisted on the U.S. public. It is designed to channel massive amounts of tax dollars to the insurance, hospital, pharmaceutical, and medical device manufacturing industries. Part of this plan was supposed to be paid for with a tax on the immensely profitable medical device manufacturing industry. I'm talking about the Johnsons & Johnsons, Medtronics, the General Electrics. However, in the last budget session, this tax was killed by our Congress. Now, that tax was something that the medical device industry, which is very powerful, hated. Let me tell you who led the charge to kill that tax. It was one of our most, those of us who are liberal, like Elizabeth Warren, Al Franken, they come from states with a big medical device manufacturing industry. They would not be in Congress if they, after the next election, had they not fought to kill that tax. So over the next 10 years, $2 trillion will flow to the health insurance industry. To get its way, the industry collaborated with the U.S. Chamber of Commerce and set up an $80 million fund to sink the whole thing if it didn't suit its preferences. By the way, single-payer people were not even allowed in the discussion leading up to the Affordable Care Act. The pharmaceutical industry was provided with an $80 billion payoff to go along with the plan. It is not working out well. Premiums are increasing, networks are narrowing, deductibles and hidden costs are growing. You might go to a hospital for surgery thinking you're covered, and you'll get a bill for the anesthesiologist for a lot, and you will ask why, and then will say he was not in your network. This happened because during the negotiations or the ACA, there were 8 lobbyists for every congressperson and senator. I think it comes to about 2,000, maybe more than that. Just take 8 times 435, is it, that we have? There is a revolving door between Congress and K Street lobbying firms. If you've been to Washington much in the last 50 years, I've been going for 50 years, and you see that massive growth over there on HK, I streets in Washington filled with lawyers. The pharmaceutical industry has 300 employees in Washington. I don't think we have that many people that are advocating for single payer. The healthcare sector now spends 4 times more than the defense industry on lobbying. So we have a profession known as bioethics, and I'm going to move into that real quickly, which is supposed to be the philosophical watchdog and conscience of our nation's approach to healthcare and other biological matters affecting us as Americans and as human beings. But this profession has, for the most part, been silent about the state of affairs. Indeed, many of the most influential bioethicists are supportive of the industrialized nature of our healthcare and have suggested that we ration medical care for the elderly to help reduce costs. I'm talking about such well-known and visible bioethicists as Ezekiel Emanuel, Brother Rahm Emanuel. He's a physician, but he's also one of the most well-known bioethicists. He's a major key player in development of the ACA. This scapegoats the elderly and distracts us from the real problems, which is profits before health. We need to seriously reform this profession, which has become too much of an enterprise. One bioethics center that I worked with and I know, they were pushing the idea of pain management, which is a noble idea, but they were also being funded by Purdue Pharmaceuticals, which makes OxyContin. That is a conflict of interest. Whether or not the folks were sincere, doing the right thing, it's a conflict of interest. This simply means that more philosophers, let me back up. What we need to do is to think about what we mean by bioethics. And I've been working with some colleagues nationally, and we've come up with a word called biohumanism. And what that means is the biological potential of every human being should be the mission of public health, whether it is medical treatment or prevention of illness. I don't know if I'm getting close to using up my 20 minutes here, but does anybody have some time? Pretty close to that. But we need to be aware of the capability of our scientists to re-engineer our genome and to invent ever more expensive technologies to compensate for our lack of prevention and preventative health. I am talking about gene editing, transplantation, implantation, and other technologies that should not be left in the hands of profiteers. If you're familiar with the CRISPR-Cas9, the ability to snip out a little part of your gene and put another gene in there, and that's not just for you, but that will be part of your gene germline. We need to be aware of multi-tiered medical care with uninsured at the bottom, Medicaid patients immediately above them, concierge medicine at the top, and everyone else somewhere in between. This cuts against American beliefs in equality and democracy. In conclusion, I want to direct your attention to President Obama's announcement of a moonshot project for curing cancer and suggest that we also need a moonshot program for preventing heart disease, cancer, diabetes, and a host of other preventable, very preventable, and manageable illnesses. How many of you have read the China study? That's great. You know, have you heard much discussion about that? It's amazing, isn't it? I don't think I've heard many people try to refute it. If we have some time, I can speak a little more about that. Universal access to good health, the kind of health care of which we are capable, will go a long way toward improving our overall health. Much more needs to be done and can be done to improve our environment, diet, mental health, and to achieve a level of well-being one would expect of one of the most advanced and economically wealthy nations on the planet. Thank you.
All right, we're going to do a little Q&A. If you have a question for Dr. Kingsley, if you would raise your hand and wait for the microphone to come to you, we want to make sure that we get your question on the video.
Hi, I was wondering if you had read the book, I think it's Do You Believe in Miracles, about kind of the rise of alternative medication and the panacea effect, and sort of as a counter for folks that are looking for cure-alls, you know, coconut oil will fix everything or whatever, and what your thoughts are on how that relates to the inability to access health care, but really it's kind of the same thing with a different, and I was just curious if you had thoughts on that and how you see that affecting.
First of all, can you hear me? Let me say that I don't have a biology, medical, engineering background. I'm a policy person. I don't know. I can't speak to alternative medicine. All I know is what I read, you know, I read a lot. And we do know that there's a lot of curatives that natives have used for a lot of years that we have brought into our own medical system. But I think it's something we really, really need to open up and discuss. Is there alternative medicines? And I think someone like Dean Ornish, let's say, many of you follow Dean Ornish, who treats patients more with diet. I think looking at the amount of red meat in our diet, I was reading a Adele Davis back in the 1970s, and she was pointing out how red meat damaged the endothelial cells in our veins and arteries. And you know, when we think about atherosclerosis, we don't know it's there, and yet we have our children thinking, I gotta go to McDonald's. And McDonald's using toys and gimmicks to get the little kids to come in and eat that stuff, which is loaded with sugar and bad fat. So, you know, and I don't blame parents, you know, culture is what it is. So I probably didn't really answer your question because I don't want to get into territory I don't really know about. Okay.
Hi, I'm Leo. So quick thing on the red meat, the study was actually on processed and cured red meats. That was implicated in cancer and other damages. So I worked in various parts of the medical industry, including research. Used to work at KU, never again, sorry. But you mentioned earlier the concept of rationing care, and I wanted to put in a comment and then ask your thoughts on it. Because people talked about this as a death panels thing, and in reality what I saw, most of my family lives in Canada, and my elderly family has gotten the most excellent care, but the thing that I noticed was that they didn't push excessive, extreme interventions at the end of life that were actually more damaging than not, because, oh, well, if you have a person who's in any stage of cancer and they're 97, are we going to continue to push do everything because they have insurance and they get payback? And that's what I noticed, that we had increased quality of care because we weren't assaulting people with unnecessary interventions because it could get payments back to the hospital. What are your thoughts on this?
Well, that's a great question. I could do 2, 3, 4 hours just on the elderly, because that's really what I moved to. I work with adolescent health, and now I do a lot with the elderly. First of all, let me say that the amount of unnecessary health care for the elderly is way overstated. We don't do so much of that. And when we talk about rationing means we could provide you with this that would benefit you, but we're not going to do it. So if you're 85 and we can do a procedure that's going to make your quality of life better, but we're not going to do it because you're 85, that's rational. And to me, that's immoral. Now, you know, when I look at, you know, a lot of people believe, I mean, the public in general believes that we're pouring all of this money into the elderly. ICU. When you look at ICU, and that's another thing I looked at in my research, the elderly don't have any higher, on average, ICU costs than 55-year-old people. In other words, we're not sticking people on a ventilator and keeping them in ICU. People rarely stay in an ICU more than 3 days. So, and that's no different for an 85. Now, let me say one thing. The NICU, Neonatal Intensive Care Unit. If I pull out the cases out of my data set that are 500,000, hospital charges are rarely more than $40,000 or $50,000. 500,000, $1 million, about 33% of those are going to be in the neonatal intensive care unit. We have become very good at saving these babies, and I'm so happy about that. We can afford it. We can spend that money. We don't hear much about it. You know, 20 years ago, a baby born at 23 weeks, weighing 750 grams, which is about a pound and a half, rarely survived. Today, 80% go home. That's pretty amazing. But that's going to cost us a lot of money. And I think we should spend it. Now, when it comes to industry, and it comes to public health, we need to reduce the incidence of low birth weights and premature babies. We can do that. But there's also an industry called, that does, they're called fertility clinics, and they're not always ethical because they advertise their services because they succeed. And if we implant 5 embryos, we're more likely to succeed than if we implant 1 embryo. So then we get multiple births. And that's, remember the Octomom in California? and that doctor didn't get his license yanked, he should have. So we're not, see, that's another thing that's happened with healthcare is we're not regulating corporations. We have scaled way back on government oversight. Any other questions I don't want to talk to on? Yes? Oh, there's a gentleman.
What's the biggest systemic obstacle to an effective single-payer system, in your view?
It's called the Medical-Industrial Complex. As I say, they spend 4 times as much on lobbying as the defense industry spends. They are now the industry that spends the most. So we have a corrupt political system, very corrupt. And there is not a congressman or a senator who can take them on. That's the problem. And that's the opposite. Because if we have a single-payer system like Medicare, which when you look at your health insurance program, the health insurance company has to provide you, or provide their 80% of what they bring in has to go to medical delivery or healthcare services. 20% they can pocket. And so they pay CEOs $20 to $40 to $60 million a year. Medicare, I look at the annual report, the trustees report, they're a little over 1% administrative costs. So you can understand why those single-payer systems in Japan or in France are going to be so much less costly than what we have here. Because basically what we have in the healthcare industry, and it's happening very rapidly, are concentrated markets. Hospitals are being gobbled up. I don't know, you remember when it was called the Verizon Center, that entertainment venue out there? It's now called Provident Healthcare Center, which is a Catholic hospital. But Catholic hospitals are being purchased by hedge funds, the big hedge funds like Carlyle Group and Blackstone. So that's the problem we have. Yes, sir. Oh, I'm sorry.
Oh, I'm sorry.
I'm coming for you next.
As a follow-up, what can the average American citizen actively do to promote change, to help change?
You know, that's a great question. I get it all the time. And I think we have to have these kind of forums, and we have to begin to tell the truth. And you have to demand the truth and recognize that what you're getting in the mainstream media, which is the entertainment industrial complex, right? Have you noticed how many of your ads now on television are now for pharmaceuticals, which should be not legal? So you have to begin to say, in what I hear is what I'm hearing the truth, and begin to talk to your friends. It's very hard for a liberal person in society to knock the Affordable Care Act. They put us in that position because there's a lot of collateral benefit for people who couldn't get coverage before. So I'm up here talking to you about it's the worst idea we could ever imagine, but it's not for somebody who finally can get health care. Although I will say, if you've got cancer and need to go to MD Anderson, I don't think the Affordable Care Act is going to help you. Because you're going to have $150,000 to get in the door, and you'll have to have $400,000 by the time you get out. So I think we have to begin to talk to each other. We have to begin to become tough-minded. I mean, we have to begin to say it's not okay to let babies die. It's not okay to let children drink tainted water that damages their brain for life. It's not okay. It's wrong. It's immoral. And the bioethicists need to be talking about that instead of rationing health care for the elderly. So that's what we need to do. You know, it's not okay for somebody to suffer and die because they don't have health insurance. That's not okay. And just me standing here saying this and you saying that, that makes a lot of difference. And we need to begin to say it. Groups like this, groups that I can really relate to, but you can spread that. Does that help?
I have some concerns about trying to fix this issue because the other thing I'm going to mention is I think will either occur concurrently or as agricultural policy and other things that have to do with not providing, I mean, you know, we can't tell people what to eat. And I'm an example of that, but it's kind of an issue. If we're really trying to prevent things more than we currently do, that is kind of problematic. That, you know, we pay farmers to grow things which aren't particularly good for us. And I have a second question, and if you're not able to address that, I understand. I work in an industry that just had some regulations come out, the financial industry, about the Department of Labor about fiduciary responsibility and roles for people that are giving advice and things like that. I work in the retirement plans area. Is there a way you think to kind of have, I don't know what to call it, other than like a health fiduciary, that when you sign on to provide someone health care, it is your responsibility to do what's in the best interest, and if you don't, then you're liable. Not the same as malpractice. So if you don't need that artificial need, but you get it, you're still fine, but they didn't act in your best interest. So anyway, that's...
Well, you know, those are two really good questions. Let me say real quickly about food and diet. We have to be very careful when we eat meat because it's got growth hormones and antibiotics in it. And that's causing a huge health problem for us, okay? Agriculture is, it's again, monopolies and oligopolies. And we know if you follow nutrition and you read the medical literature on an ongoing basis, you will come to the conclusion that a plant-based diet would do a lot for our health. And that's what the China study is all about, by the way. And I really recommend that. It's T. Colin Campbell. You can get it at Barnes & Noble. And I really recommend that you read that. So that's the agriculture, how we grow our food. And it's not just what goes into our bodies, but what it does to our ecology. What it does to the bees, to the butterflies, the glyphosate, the Bayer stuff that they're putting out that kills the bees. I mean, this is bad for us as humans. You know, if we talk about biohumanism, we have to think about the world we live in. And what do we want for a world? Do we want food that's, that nutrition has been bred out of it? Or do we want organic, well-grown, which we can do? It won't be any more costly to grow food that's organic. Remind me, your second was about fiduciary responsibility. That's the FDA's business. And they've been severely weakened. Our FDA is not doing its job because, again, when you have the immense amount of money and power that is in the pockets, okay, of wealthy individuals, when you look at, let's say the libertarians were one of our biggest problems. They're dangerous because they say government is bad, markets are good. They're funded by the Koch brothers and the Show Me Institute and those kinds of organizations. I have a little prayer. I say every morning, God, let me debate a libertarian today. Because they don't know the Constitution. They are ideologues, and they're hurting us. They're really, really hurting us. And by the way, to answer your question, we need to say that. Along with other right-wing organizations that want to kill government. Okay? We need government. Government is good. We have a constitution based on that. Our government, now, sure, government can do bad things. You know, I happen to be a big fan of Snowden's. Okay. So anyway, I didn't talk too long.
No, you're fine. I know there's still lots of you with questions, but we do want to wrap it up. But you'll be available afterwards, so you feel free to find Dr. Kingsley and ask him those questions you didn't have the opportunity to ask. Could you give him a warm